Good morning, everyone. Thank you so much for coming. It's an honor to be able to speak in front of the whole Asan Plastic Surgery Department. So I'm from the Singapore NHG, which covers the central part of Singapore. Singapore has a population of 6 million with 11 public hospitals. So within my cluster, we have 3 hospitals that are interconnected, and the consultants in each of these hospitals help to cover and support each other. So NHG Plastic Surgery is like a family away from home. We are very close-knit and we support each other through big cases. As you can see, our manpower currently is quite lean. We have 7 consultants covering 3 hospitals. And so the reason I'm really able to be here today, it's because these people back home are helping to support my hospital in my absence. So I'm really grateful for them, and that's why I also want to maximize my time here and my learning. So people often ask which hospital I'm from. It's quite impossible to remember the name. Khoo Teck Puat is the name of someone who contributed a lot of money to the hospital. So since I am currently in Korea and did my fellowship, we can call it the K Hospital. So KTPH is an 800-bed general and acute hospital. It opened relatively new in 2010. And as you can see, there's a lot of greenery. It's very zen. We have won multiple international design awards for eco-friendliness. So my journey, I completed 6 years of plastic surgery residency, rotating through all the plastic surgery units in Singapore. In 2021, I joined KTPH as a consultant, and a little over a year later, my boss left for the private practice, Dr. Pik Chong Han, and so I took on the headship, and for a while, I was the single plastic surgeon hired in my hospital. It was a stressful period, but I'm very thankful for my colleagues from the other hospitals who helped support me through the big cases. And just shortly, 1 month before I came, we had a second consultant join, and that's why I can be here today. The KTPH plastic surgery team is around 8 years old. We only serve adult patients. We perform the full spectrum of plastics, recon, and aesthetic surgery. And my team comprises of 7 to 8 members. We have 2 to 3 junior staff who helps the ward work and assisting in the operating theatre. We have a senior resident who rotates around the different hospitals. We have 2 resident physicians. One of them has been around for many years, and she's competent and independent in raising flaps and doing microsurgeries independently. So even though we're a new unit, we've been growing year on year. Even during the COVID years, we do around 400 cases every year and around 20 to 30 free flaps a year. You can see on the picture on the right, that's us celebrating our 100th free flap in 2022. So my reconstructive load, we cover the full range of reconstruction. My most highest caseload is actually lower limb, followed by breast, and followed by craniofacial. I chose to do craniofacial for my fellowship, firstly because it's what I was interested in, and secondly there is a need in my cluster because there are not many people who are doing head and neck reconstruction, and so I wanted to challenge myself doing something that I'm least comfortable with, to be able to provide holistic care for all my patients in the hospital. So we don't do any major burns. Beyond surgery, I also help to teach at the medical schools in Singapore, and the rotating residents who rotate in through my service. I sit on multiple hospital work groups, and as you can see, even though we're a very small unit, we have been featured multiple times on Singapore's media, including local TV shows, English and Chinese newspaper, radio interviews. So the pivot point for me coming to WSRM is really when I took on the headship of the social media committee during Singapore's 2023 WSRM conference. It was there that I worked closely with Professor JP Hong, and I got to know some of the previous Asan fellows, Feras, Gib, as well as Hang Yu Cha. And also during WSRM, we attended the International Fellowship Speed Date session where I spoke with Professor Jong and Professor Park. So after deciding that I wanted to come to Asan, in preparation, I took on Korean lessons as well. So before coming to Asan, I spent 2 weeks in Changkeng And before going there, head and neck reconstruction has always been something that's daunting to me because of the potential post-op morbidity, and the operations usually ends really late into the night. And I remember when I went there, I saw Professor Chi Hong Lin doing 2 double free flaps in 2 patients in the same day, and he made it look so effortless, and that really inspired me to continue my pursuit of head and neck recon. So I arrived in Seoul in November, just in time for PRS Korea, and it was there that I met Ho Hyung, and his first words to me then was, "I'm going to be the only Korean fellow next year. Please do not run away." And so I started my fellowship in December. So within a week, as I started, there was already the Asan Plastic Surgery year-end party. The following week, we had alumni night for international visitors. And the following week, we had the TMA Christmas party. And I was like, wow, I really started my fellowship at the right time. So the learning, I did 6 months in Team C, and I managed to spend some time in Team A and Team B as well. I participated and observed in a total of 180 operations. We had 64 free flaps. Majority of the cases were head and neck reconstruction. I think what is really unique is that I managed to get a good number of aesthetic surgeries as well, which is something that I was interested in learning. And I think it's unique that I get to learn recon and aesthetics all in Asan itself as well. Managed to see quite a number of rhinoplasty cases, 13 facial palsy cases, a number of lower limb and DIAP flaps as well. So specifically in Team C, these are things that I knew that I'm either unfamiliar with, or things that all the little learning points that I can incorporate into my practice. And initially, before I did this presentation, I was thinking, wow, even at 6 months, I'm still learning so much. I really don't want to leave. But after looking through, writing down all my things that I have learned, I feel that I've learned so much, and it's really time for me to go back to incorporate all these into my practice. Team A and Team B as well. In Team A, I managed to see perforator to perforator recon, see multiple skip flaps as well, and discuss challenging cases of lower limb reconstruction. And I thank Andrew for teaching me ultrasound mapping. Yeah, he's really good. And in Team B, I managed to see multiple DIAP flaps. I saw lumbar artery perforator flap for the first time, PEP flaps, and he also challenged my thinking with pre-pectoral DTIs. And I saw robotic-assisted transaxillary BAs for the first time. So I was also fortunate to be able to see some re-explorations in each of the team. I think that was something that I was really interested to learn, because every time I do a re-exploration, I'll always be thinking, could I have done more to salvage this flap? So I'll be very thankful to be able to discuss the principles and see what you do for all your re-explorations, and this will guide my future practice. So I'm very thankful to Matty for introducing me to the world of Notion, and it has helped to organize my learning here in Asan. So for each of these cases, usually I'll go back and then I'll create a case log for all 180 cases. And within each case, I would then create like a note. And I think this is really useful next time when I have a similar case. I can search up what I still saw in Asan, what are the notes, what were done, and it will really help guide me in future. It's like my secret manual. So beyond surgery, I also observed lots of adjuncts, tips and tricks, how you guys do your dressings, how your operative setup is to make it the most ergonomic. Your operative records are really amazing. Even CT angio is something that I already spoke to my colleague, and he's working with radiology back home. I think it's really useful to assess the recipient vessels preoperatively. I saw how you set up for your robotic BAs, as well as how you set up all your instruments for the lap flaps to maximize the visualization of the pedicle. It's all little tips and tricks that I learned. And of course, Ho Hyung's makeshift local HBOT, which has seen a successful result this morning. Yeah, so it's all these small things that I can incorporate into my practice. But I think your best adjunct here in Asan is really your nurses. So this is a picture of the iPad. It was during our Professor Oh's facelift surgery on a Saturday. So I saw the iPad, I asked Jia, is this your iPad? And she said, no, she thought it was mine. But it's actually one of the nurses' iPad, and she had highlighted and marked to make notes on her elegant textbook on the steps of the surgery, and I was really impressed by how driven your nurses are. So during my time here, I was fortunate also to have had learned from various visiting experts, and I'm thankful to Professor Choi for making connections and linking us up. But even without the visiting experts, actually we have a lot of local experts within Asan. You know, Professor Choi has a whole bank of presentations, and I really appreciate that he takes his time to, when he has time to go through some of his presentations and we can learn from them. Even Professor Sa also has given us lower limb recon lectures as well. I managed to visit some private clinics as well, majority of which were introduced by Professor Choi. And yeah, managed to see bleph, bone contouring, rhinoplasties, and I was also able to do a voiceover for Professor Dr. Choi Chang during APS as well, as he wasn't feeling so well. So my time here also coincided with various conferences, including the R&R conference last week. So what I feel makes Asan Plastic Surgery unique, firstly, I think it's your constant pushing your boundaries and your limits. You know, it never stops. You're always thinking, what's the next step to make it better? It's always a movement forward, and with thin diaps and, you know, scapular flap, and now we're going to do bony palate as well in addition to the total maxilla. I think that's what makes Asan so successful on the international front. And also your drive for academic publications. So every time I ask Professor Choi a question, he'd be like, actually I have a paper on it. He has a paper, I think, for every topic there is out there. Yeah, and during my time here, we've also, you had the lymphatic surgery for dementia, and I'm rooting for Asan to have their first face transplantation, hopefully in the near future. Secondly, what I feel is unique is the culture. So I've spoken to some Korean residents in other hospitals, and they say that the culture here is quite unique. I feel that very thankful that all of you are very hospitable to all the visitors, and that's why everyone really has a very good time during their stay here. And thirdly, which I think is very important, it's forming international connections, which I think is a very key part of a fellowship. So the unique thing about Asan is that you have such a high volume of visitors every month, turnover. You can see, like in this picture, there's 7 of us, and all 7 of us are from different countries. So it really helped me to make connections with plastic surgeons and colleagues from all around the world. So I'd like to say a moment of thanks to the professors. So firstly, Professor Choi, it has been a privilege being able to work alongside you and learn from you. I'm very grateful for how you have taken me under your wing and try to impart to me everything you can. And I'm very touched by how you've always rooted for me and your desire to see me succeed. Through the 6 months, we've experienced many happy moments, moving moments that made me shed a tear as well, and emotional moments that broke my heart. But through it all, I've seen how much you care for your patients, and your patients are very lucky to have you. I'm proud to have been your fellow and always remember you and your teachings in my daily practice. Professor O, I really enjoy joining your operations because you always make us laugh. I can probably collate a quote book of all your quotes in OR. You have always expressed your gratitude for our help, and I've always felt very appreciated in your OR, but I feel like I'm the one benefiting more from you. So I'm very grateful for the many opportunities you have given the fellows, like raising a skin flap and a smash flap for first time. And you've always been very eager to teach. I think if I owe you millions of dollars of money if I had to pay for every secret technique that you teach us. So a pro tip is to sit next to Professor O when he's drinking, because he tends to give up money when he is drunk. It's a true story. So Professor Jong has been an inspiration. I've not seen anyone so passionate about microsurgery. He breathes and exudes microsurgery. He calls himself a microsurgery otaku. He's unfazed by any operation, and he operates like a machine. I remember there was one day we had 3 different ORs, and he did the microsurgery for all 3 cases. And I also remember a very challenging hypopharyngeal case. We did a second revision free flap. The following day, he brought the patient in at midnight and did a 3rd flap all by himself until 8 a.m. and then a 4th flap a few days later. So when I heard it, I was stunned, because I can't imagine how mentally draining it was to be doing a 3rd flap all by yourself through the night. And watching him push through the surgeries with resolution is something I really respect and will always remember. And thank you for bringing us to our first baseball match. And I'm rooting for Hanwha to be #1. This is the latest standing so far. To Professor Kim, the long surgeries and emergency cases late into the night are always the most memorable. No matter how late the surgeries or how long the cases are, I'm always amazed by how you're always cheerful and joking. And he's the epitome of API, assume positive intent. I've never seen him angry no matter the situation. And his favorite line is, "It's okay." I'm really impressed by how hard he works and is like a battery that never runs out of energy. So whenever I face long hours, I always remember, if Professor Kim can do it, so can you. I really wished I could spend more time in Team A and Team B. To Professor Kim, I think Professor Om is not here. It's been a joy operating with both of you. You both, I feel, have the most swag and are some of the coolest surgeons operating. You operate really fast. Thank you for patiently answering all my questions. I've learned many things that will greatly change my breast practice back home. Professor Sir, thank you for generously sharing your knowledge with me. Tapping on your brains is like asking an encyclopedia. Every time I ask a question, it's always, what is the evidence out there? And yeah, the drawing here is, this masterpiece is something I'll use to teach my residents. And Professor Park, he's a real gentleman. He's always looking out for the fellows. He knows I can't drink and always pour me the smallest portion of soju. Thank you. I really appreciate your kindness, hospitality, and friendship. And to our new Professor Kwon, I remember my first few weeks when I saw how hard you work. I was so impressed, and I told everyone back home that the Koreans are a whole level of hardworkingness. So I wish you all the best as you embark on your new role as a professor. To Ho Hyung, I enjoyed working alongside you through the past 6 months, supporting each other. You've been helping me in and out of the hospital. He even bought my dog an automatic feeder when my husband was out of the country. So yeah, we worked hard together. You can see this is us pushing the trolley to the recovery area. I have to say that we are very fortunate to be able to come during a time when there are no residents, and it has opened up many opportunities. And it's through working hard that we feel integrated with the team, and it has enhanced my whole fellowship experience. And to my other C-Team fellows, Jia, Meti, Chingan, and Naeem, we have forged a bond in Asan that I'll never forget, and I look forward to watching all of us grow together in the next stage of our careers. So outside of Asan, I was very lucky also to have my husband with me throughout this whole 6 months working from home, and my dog, his name is Tofu. So he has met most of the fellows and friends, and it's because of that I think I could really thoroughly enjoy this 6 months even more. And we managed to travel all around Korea. It was also during this time that I managed to pick up snowboarding properly. We went on 8 trips to 6 different ski resorts, traveling around Korea. And yeah, I really fell in love with this country. I love the food. I've been eating Korean food for 6 months. I'm still not done. And I look forward to coming back for future conferences in Korea. And of course, living the K-drama in real life, the political turmoil. We also attended our first protest, which is something we won't get to see in Singapore, so it's very unique to us. Yeah, it was really an interesting experience. So what next? I'll be going back to my hospital. I'm looking forward to integrating everything I learned from Team A, Team B, Team C. And I'm looking forward to imparting the knowledge that I've learned here, sharing with my fellow residents and fellow colleagues, and yeah. So every time I walk through the door and I see my name, I'm like really proud that my name is on this wall of Asan, and I'm even more honored that I made it to the department photo that's in this conference room now. I think the time we spend here will be one of the highlights and core memories of my personal and work life. Yeah. So I'd like to end off with a poster that I created of Asan Team C hospital playlist. It consists of the professors and some of the fellows and visitors who came through during my time here. And yeah, I'm really thankful for everyone here who made my time so enjoyable. So we have aesthetic conference next month in Singapore. If any of you would like to come, I would love to host all of you. Yeah, 감사합니다.
Not easy to add anything, Jolie. Yeah, so without you, yeah, so my life in the hospital would be very boring. So actually, not only you, but also me actually was impacted by the working together. So I really appreciate it. So yeah, let's talk more privately. So many things to say, but yeah. Okay, so we will give the plug in the dinner on Thursday, right?
Thursday.
Yeah.
Okay. Yeah.
Any comments?
So what is your plan after you're coming back? I saw you are coming back to K Hospital
I'll be there at least for the next 2 years.
next 2 years.
Next 3 years at least,
3 years.
I'm bonded, yeah.
Is it mandatory? Or?
Yeah, it's mandatory because of my time here. Yeah, but I mean, I feel that there's still so much for me to do and learn within the public hospital. So no intention right now to leave for private practice. Yeah. Until it comes to a point that either I'm not learning enough or, yeah, maybe to move to the next step, I might consider that.
So Singapore, there's only 90 plastic surgeons.
Yeah,
Right?
yeah. Half are in private, half are in public hospitals. Yeah, there's a shortage. I think they were too stringent on their residents. We take maybe around 3 residents a year, but recently we realized that we're so short, so we've been increasing. So I even had to offer a plastic surgeon from overseas because there's not enough, and I really want to expand my service. Yeah.
And what is the biggest change after staying in Asan?
So I think that it will definitely be head and neck reconstruction. It's something that not many people are doing in my cluster. There's really a shortage. It's something that I did before, but not as confidently. So now that I have seen a lot of head and neck recon, something that I will definitely push to do more cases and take on more head and neck recon cases. Yeah.
Thank you for recalling our memory. Thank you, Jolie.
So